What does it take to have diabetes remission? Well, according to the statistics, about 10% of the world's population has diabetes. Over 500 million people worldwide have diabetes. And similarly, over 500 million people worldwide have prediabetes. So in totality, that is roughly 1 billion people in the world have either prediabetes or diabetes. And that number is only increasing. Hi guys. Welcome back to my channel. This is Dr. Philippe here, and in today's video, I wanted to break down the truth about curing diabetes. What does it take to have diabetes remission? Well, you have to have normal blood sugar levels outside of the diabetic range for at least 3 months without any medications. So how do you diagnose diabetes? Well, for diabetes, here are the 3 most common ways that type 2 diabetes are diagnosed. You have the hemoglobin A1C. If you have a hemoglobin A1C of 6.5% or higher, that meets criteria for diabetes. Another way to diagnose it is by having a fasting plasma glucose level above 126. And then one of the other more common ways for pregnant women to get diagnosed with diabetes is by doing a glucose tolerance test. Typically, in order for that criteria to be met, you have to have a blood glucose level of 200 at least 2 hours after having consumed a certain amount of glucose. Now, in order to qualify for diabetes remission, you need to have normal blood glucose levels for at least 3 months after stopping diabetes medication. This has been shown to be possible. There was a study out of Hong Kong that involved 37,000 people with diabetes, and they found that only 6% of those people managed to achieve diabetes remission. How did they do that? Well, they lost at least 10% of their body weight. Now, I know what you might be thinking, the 6% number is very low, or even though it's a low number, I think the way you should be looking at it is that it's possible. No one ever said it's going to be easy. Nothing in life worth having comes easy, and nothing easy should be taken for granted. So again, this study is important because it shows that it's possible to achieve diabetes remission, but it does take hard work. It does take a mind frame shift in how you look and approach foods. Check this video out or the link in the description as far as how you should reconsider looking at carbohydrates, etc. Basically, what this means is that it's possible. It's not easy. And if you look at any weight loss study, the biggest issue is consistency. Consistency is really what's going to help you achieve this goal of yours. It's really going to help you break through any specific barriers you might be having. As it relates to type 2 diabetes, prediabetes, insulin resistance, metabolic syndrome, or anything else related to your health, make sure you're discussing this with a healthcare provider, your primary care provider, so that you can have your blood levels checked, so that you can maybe discuss talking to a nutritionist, a dietitian to help you craft a plan that's going to work for you, one that's going to help you achieve diabetes remission. Because not for nothing, if at least 6% of people in that study can do it, that means a lot more people can do it. It's just very hard to remain consistent. And that's just the truth. It's not going to be easy, but it is possible. And I see this all the time. A lot of patients come to me wanting to get off insulin, wanting to get off diabetes medications, etc. And I tell them it's possible, but it's not easy. Consistency is where you want to put your effort in. Consistency and discipline. If you want to save yourself some hospital bills in the future, you need to put in the work right now, period. But again, always talk to your healthcare provider. Consider looking at talking with a nutritionist or a dietitian. Go look at your food cabinet, your pantry, your fridge. Toss out all that juice. Toss out the cereal. Toss out the cereal. Toss out soda. Toss out all the unnecessary and unhealthy carb sources in your house. If you want to be healthy, if you want to be healthier, you need to become more disciplined. And always remember, nothing in life worth having comes easy, and nothing easy in life should be taken for granted. And just know that this is possible with added hard work and discipline. Thanks again for stopping by my channel, guys. Don't forget to like, comment, and subscribe, and I'll see you in the next video.